Hey everybody, Forrest and Dennis back with you at Life Assist, clinical product specialist, and it is time for Supraglottic airway demonstration.
Supra, not super.
Yes.
Supra. Toyota. Supra.
Help me, man. Anyways, okay, so iGel, AirQ3, Argain. Let's do it.
Let's go.
Start with the iGel, okay? So, out of the box, we talked about the recess pack, comes with the strap and comes with lubrication. Obviously, my patient would be pretty much unconscious. I have already lubricated this, but we would lubricate this prior to insertion.
All right.
So I would put kind of just lubrication right around the edges here, maybe a little in the back.
Yeah.
Just gonna help for a smoother.
Anywhere that's gonna kind of touch that skin, you want to kind of give it a little bit more help.
When we do it, we're gonna put our patient in what's called a sniffing position. Okay.
So nose is up.
Yeah. We're gonna grab that bite block that's in there, and we're gonna insert at the top hard palate of the patient's mouth.
Similar to what we did with the other airways, where
Yep.
you don't want to trap that tongue down in the throat.
And we're literally just gonna follow the path. Now, sometimes you get a little bit of resistance, but at the end, you just kind of get it, and it seats all the way in there.
All right.
So now, if everything is correct,
Uh-huh.
I'm gonna have you hook this up.
We're gonna hook the bag in.
Before you push it, the stomach should be blocked, and the lungs should be open to receive ventilation. Let's test it.
All right, and we go in, and only the lungs are moving.
Yeah.
So I think we've got a good seal.
It's perfect. It works great.
Now,
So what's good to note too on these is that they have, you can kind of see a marker where it is at the teeth. And now we can just eyeball that and remember that that is a good spot for it, okay?
Okay.
So now we can apply the securement strap, which is kind of a flexi neoprene, I think.
yeah, it's like a neoprene, so there's a little bit of elasticity to it, so
Yeah.
it gives you a little bit of
And look
leniency.
at that, it secures beautifully. It's where I left it, and now we know that this is a good spot to get the proper ventilation.
Gotcha.
So, options.
Yep.
Let's
we
say-
know we've done the bag.
Yeah,
What else
we've
can we
done
do with
that.
this?
So we can suction. It's got the suction.
Oh, that's
port
right.
there.
This one sucks.
Yeah, it does. Is that funny?
No.
Okay, so if we had to, gastric contents are coming up. I could drop this tube in here and fish it all the way down.
Are we
Now
gonna actually
remember,
see it on this mannequin?
yes, you're going to see it because remember, there's that little hole at the end of the eye gel.
There it is.
And there it is. It's
So
gonna
totally. So we're running parallel to the airway
Yep.
on this thing down into the stomach.
hook up your automatic suction unit, and boom, we're getting that gastric contents. 'Cause
I
remember,
actually saw some
when
contents
CPR is
come up.
happening, some gas and stuff can build up, and it can cause gastric contents.
Yeah. It's
Okay.
very traumatic down there.
It is. Final thing, let's say we just want to passively
right.
oxygenate. We can actually pop this tube, and we have our handy dandy O2 tank, and it'll connect right on.
So you just
Yep.
put it right in there.
And then whatever we want to do for some...
you did
I know,
way
this-
too much lube on this mannequin.
Yeah, this
Slippery.
thing is on there.
And then we can
so-
turn the oxygen on, and you've got like straight oxygen
You got
going into the
passive
patient.
oxygenation going on if you feel it's needed.
Passive
So,
oxygenation.
yeah, that's just what they
You're
call
just
it.
making me feel like using the big words. Huh?
I'm using medic terms.
Someone bought a
So-
thesaurus.
So that's pretty much the iGel. Simple, done,
Yeah, no,
easy.
it's pretty easy. I like that.
So
I like
we're just gonna go and you can pull the whole thing out. We'll get that.
There we go.
All right, so that's the iGel. I'm gonna put that one over there.
All right.
All right, and then we will remove this. So that's good. We're gonna go right to the AirQ3. I'm not even gonna say anything because it's the same
It's
thing.
the exact same thing.
We're gonna
same
do the
process.
same thing. Yeah. So I'm gonna go ahead and do the same insertion, same prep, lubrication. We're just gonna drop this thing in.
Going at the roof of the mouth
Yep,
to
roof
avoid
of the
that
mouth,
tongue.
and it should just eventually seep its way in. Let's
And
check
so
it
you're deep
again,
in there. We'll go throw the BVM on,
and we should.
and then you should get
Boom.
just the lungs rising.
Just the
so we
lungs
know that
rising.
we have a good seal. We're not getting air into
to
the
go.
stomach. We're getting air into the lungs.
Yep. So now we have option time. Again, this one has the gastric channels, not one but two.
This one had two.
two.
So it sucks twice as hard.
It does. So you can fish this one all the way through. I don't need to go, but it'll come out the stomach as well. And not only on that side, but you can also fish it down on this side.
All right. And there was something else about this one, right? That little
Yeah.
red cap comes off, doesn't it?
It does. So let's say that you wanted really to get a more definitive airway, like an endotracheal
You've established it. The patient's not responding.
Yeah.
Oh crap! We need to go something stronger.
Yeah, so whatever reason it is, this thing allows you to facilitate and take off this cap, and now we can introduce an endotracheal tube, which is going to be our next series of videos.
Normally, you need
Yeah.
laryngoscope for this
laryngoscope.
process
Right.
because it's very, very.
Which we're going to go over extensively in our next video. Usually if we're going to introduce an ET tube, we would have to, get our scope and we would have to
Watch it
manipulate.
go in.
But I won't go too far into that now,
Right,
but
right,
just
right.
know that this can facilitate. So basically all we would do is it would slide it down and then it would enter, and then from there we can, pull out the stylet and ventilate it. So it has that option, which is
Okay.
really cool. But most of the time I think this works great. I mean, you just saw it ventilate. I mean,
Yeah.
it works great. So a lot of success with these. Okay, so that's pretty much the Air Q3.
And you don't have one of these little straps with this
It
one. It
doesn't.
won't work with the strap. You normally would just tape it down, or
It would, yeah. So you can use medical grade tape, and you could literally just do tape one side of the maxilla to the other side of maxilla, and it'll work great. But I mean, as you can see, once these things are in there, I mean, go ahead.
They're pretty
You
situated
don't
in
yank on it, but I mean, it's in there.
It's seated pretty well.
And again, it has those markings at the teeth, so if it starts to come up too high or it dips down too low. Minor
You've got a baseline of
adjustments.
where you set it,
Yeah,
right?
and you'll feel it when you're bagging too. You'll feel to see if that chest is rising. Okay, so that is the Air Q3.
Yep.
And then finally, we're going to go to the Argain. Now remember, the Argain has a lot of the similar features, except this one has a cuff that can be inflated to the user's liking.
Right.
So when you start it, I usually connect it first just so it's there. And of course, we're going to flatten out the cuff.
Okay, so there's no air in the cuff.
No air in the
Attach
cuff.
it. Attach the.
Yeah, attach it so it's
syringe.
there, and then again we're going to insert the exact
Is that
same
a
way.
special syringe, or is that just like a normal syringe that you would pick up? And
This is a normal syringe that we sell.
okay, so it's not a very specific syringe for these types of
No,
innovations.
you could use. I mean, this is a 20 ml. This is plenty,
Gotcha.
and it'll work. Even if you had a 10 cc syringe, you could air it and then pull it out and then air it up again. So, okay, so we got this. I usually just kind of let it dangle. We're going to insert exactly the same way.
Roof of the mouth, avoid
Roof
the
of the
tongue.
mouth, yep. And then we are just going to go all the way down in until it's seated. So now what I want to do is I want to inflate my cuff, okay?
And there's a certain
And I have
amount
so much of this
that you wanna
lube
put
on
in.
my hand, I can't do it. Can you do it?
I could do it. I could do it for you. Oh, geez, that is.
It's slippery. So go ahead, push it,
All
push
right,
it, push
all right.
it.
Are we going all the way?
And good. So now go ahead and hold it down though. And then, okay.
So there's an auto lock. The air doesn't come out.
Yep, we're inflated.
Uh-huh.
So, I mean, before we even ventilate, go ahead and give it a little pull.
Yeah, we're pretty inserted in
We're
there.
pretty inserted in
Yeah.
there. So let's test it out.
All right, and then we just throw that on there, and let's
And-
just see the. There we go. Lungs are rising.
Lungs are rising.
And that
stomach is not
stomach
doing
is
anything.
not even touching, so we're good to go.
Okay, so again, I know, same thing.
God, this thing's on. I need some lube.
I know, right? So again, the Argain also has the suction gastric.
Doesn't
in it.
suck as much as the other one.
It doesn't. It's just
It doesn't
one.
suck as much as the.
But just because we didn't do it last time, let's see. Is it coming out? It is. There it is.
there we go.
There we go.
Yep.
So again, just to prove it, it does work. And then finally, this one also facilitates an endotracheal tube. Same exact thing. There's no cap on this one, so you don't have to pull anything off. But again, you can do it. It'll insert and it'll take the endotracheal tube.
Nice option to have.
Yeah. So I mean, basically, in a sense, guys, that's how simple these supraglottic airways are. They're very easy to insert, but yet they have a lot of extra features that just help facilitate keeping this patient's airway as patent as possible, and there's room to make adjustments, if needed. So
Yeah, in terms of administrating, they're exactly the same across the
Yeah.
board. The only thing is like there's a little bit of subtleties.
couple little subtleties
on,
here and there.
between the three.
And then again, too, not everybody secures these down, but you could just use some medical tape and you
No
could secure
X
it down.
cross or whatever you want to do.
And secure it down. I think with the lubrication, I don't think the tape's gonna stick.
Yeah.
Okay. Guys, thank you for watching this, the Advanced Airway. So this is going to wrap up the Supraglottic, and it's going to actually wrap up the Advanced Airways.
Oh, I thought. Wait, so wait, but there's more advanced.
There's more.
There's an advanced airway.
So there's endotracheal tubes.
So
and
more airway coming up next.
The most definitive airway in EMS is coming up next. Thanks for watching. We'll see you not in a minute.
Not in a minute.
Okay. Take care.